Hi everyone, happy Women Wednesday. Hope you're doing well on this gorgeous day while we creep into spring weather ever so slowly. Today we're going to talk about picking an IUD option or picking a birth control pill option. There are so many options out there and available to folks. Just wanted to kind of go through what they are and the different reasons to consider why it might be the right option for you or why it might be the wrong option for you. It's also an incredibly timely topic. When I was working on this script last week, I couldn't have imagined how especially timely it would be. I mean, birth control has always been a timely issue because sex is always happening in real time, and whether it's consensual or not, people should have the option to make the decision for themselves on whether the other timely issue of keeping a baby that they can't provide for or have to choose to struggle to feed and care for both of them makes sense for the next chapter of their lives. So today we're going to kind of go into some of the creme de la creme that is public health interventions and support, and that is prevention. So whenever there's a illness to avoid or a disease to avoid or anything that could make it so that you have a long-term relationship with being in the doctor's office a lot, prevention is the key. Hey Paul, love the new hair. Looks great.
Thank you.
So yeah, we're just going to dive into lots of birth control prevention options. Prevention is key, and I'm excited to get into this conversation with everyone today. So my name is Jewel, and I use she, hers pronouns, and I work to bring educational Instagram lives to this space with the Whitman-Walker Health's community health team. Today we're going to discuss picking an IUD and picking a birth control pill. So when I was reviewing kind of a history of and timeline of just birth control and preparation for this live, I found a few things that I thought were fun to highlight and just great information that people should know. So in 1957, in the summertime, the FDA first approves the use of Enivid for the treatment of severe menstrual disorders and requires the drug label to carry the warning that Enivid will prevent ovulation. So this is like the first birth control ever, but people weren't allowed to market it as birth control. It had to be marketed as a pill that would help prevent like menstrual health symptoms that were super severe. In 1959, President Dwight Eisenhower states in a press conference that birth control is not a proper political or government activity or function or responsibility, and adds emphatically that it is not our business. So early on, when birth control first hit the market, the United States government, the head of the United States government, said that birth control is not our business to regulate or have our policies be a part of. By 1962, there's 1.2 million American women on the pill. That's a figure that I found, but let's keep in mind that, of course, there's the question of access. Who was able to access this birth control pill? It probably wasn't equitable access across race lines and ethnicities and whatnot. So just heads up on that. By 1963, there's 2.3 million American women who are using the pill. By 1964, less than a decade after President Eisenhower had declared that the government should not get involved with birth control, President Lyndon B. Johnson pushes through legislation for federal support of birth control for the poor. There's lots of levels to that, but we see that people want to increase access for it for various and different economic income lines. In 1974, just 15 years after President Eisenhower declared that the birth control is not the government's business, the government supports birth control clinics in 2,379 of the nation's 3,099 counties. Of all the methods dispensed, the pill is the most popular amongst people using it. In 1982, the pill's impact on women in the workforce is significant. With highly effective birth control now at their disposal, 60% of women of reproductive age are employed in America. So having access to birth control directly impacts the economy and women's access to providing for themselves and not having to rely on a partner or marriage or someone else to be their base for income. By 1984, an estimated 50 to 80 million women worldwide are taking the pill. So we see how impactful it's been. And finally, if my math is mathing, from the latest data between 2017 and 2019 at the CDC and Guttmacher Institute, over 10 million American women of reproductive age, which ranges from ages 15 to 49, are currently on the pill here in the US. And a total of more than 47.2 million American women are on some sort of contraception, whether that's the pill, an IUD, an implant, or some other form of birth control. So it's super important. And when those mediums of birth control aren't available to you, or you didn't know that these mediums of birth control were available to you, or just very inaccessible to you, and you do experience pregnancy, there still should be that final step of birth control, or birth prevention, where you get to choose what your future looks like. But that was the intro. So let's get into a little bit of review from last week. Last week we learned that if you're looking for birth control or something to help with menstrual symptoms or acne, there's an option out there for you. If you're underinsured or uninsured, you can explore your local sexual health clinic, your community health center, a Planned Parenthood, or a state's health department for free to more affordable birth control options. If you're going through hormone replacement therapy or HRT and are taking testosterone, you're likely still capable of getting pregnant depending on the types of sex that you're having and the partners that you're having sex with. So HRT and hormonal birth control can be safely used together. And if you haven't undergone bottom surgery and you are fertile, pregnancy is still an option for you. And the third thing that we learned last week is about the pull-out method, one of the most famous ways to prevent pregnancy for generations and generations. So if you're looking to get pregnant, the best preventative option you can use is the pull-out method. And if you're not looking to get pregnant, the worst preventative option you can use is the pull-out method. The pull-out method has a perfect use failure rate of 4%. So this means that when it's done perfectly, the pull-out method prevents pregnancy 96% of the time. And a perfect pull-out means that the sex partner with the penis pulls out of the vagina or front hole when they feel they're about to ejaculate and offload away from their partner's genitalia. Timing can be super hard to control, and this doesn't take pre-ejaculate or pre-cum into account. Pre-cum can have sperm in it and can get a person pregnant. So the perfect pull-out also involves taking precautions before having sex again, and you have to make sure that the penis is totally free and clear of residual semen, and the person needs to urinate and clean off the tip of their penis before going in for another round of sex. Now, given that nobody is perfect, it's estimated that 18 to 28% of couples using the pull-out method will get pregnant within the first year. And so that's largely because it's hard to pull off a perfect pull-out. And for folks who aren't in couples, or for the single people out there, this means that you could get pregnant within the first year if you're engaging in sex and using the pull-out method as your only form of contraception or birth control. So those were a few things that we learned last week together. And now we'll go into different kinds of pill options. So hormonal birth control methods are most often used on a regular basis. The levels of hormones differ based on the contraceptive, and they may stop the ovaries from releasing eggs, thicken the mucus around the cervix, or thin the lining of the uterus. One of the most commonly talked about hormonal birth control options is the pill. So the pill can be anywhere from free to $50 per month, and this is dependent on your health insurance coverage plus the cost of that initial doctor's visit. The pill contains estrogen and progesterone to prevent ovaries from releasing eggs, and in turn prevents pregnancy from taking place. So the pill must be taken every single day at the same time to work most effectively. And there's also a mini pill option that doesn't have any estrogen in it, but does just instead include progestin. Because it doesn't contain estrogen, the mini pill is a good option for anyone who's breastfeeding, over 25 years old, less than 1 month postpartum, or who has a bad reaction to the combination estrogen and progestin pills. People who use the pill or the mini pill report less severe period symptoms, which is always a plus. And some people who use the mini pill have reported breast tenderness and acne flare-ups. Bedsire.org shares the following list of, I'm going to name a few, but they share the following list of combination pill names. So this is all just to say that there's a lot of options out there, but there's Levlin, there's Lacina, there's Levora, there's Lewestrin. I think I personally had a bad experience with Lewestrin, but every birth control is different for every person's bodies. There's Yaz, there's Yasmin. I have friends who said they'll never take Yaz again, but also people who loved it, worked great for them. Again, this is all to say that your perfect birth control pill is out there for you, but it might take kissing a few frogs, if you will, before you find that right one that's a good match for your body. Bedsire.org also shares a list of mini pill names. So there's Camilla, there's Erin, there's Jolivette, and there's Micronor. There's only a few on the market, but if you have bad reactions to the estrogen and progestin pill, you can always explore the mini pill, which is just progestin. According to Mayo Clinic, your doctor may discourage you from using the combination birth control where it has both estrogen and progestin if you have just given birth, if you are older than 35 years old and you smoke, if you have poorly controlled high blood pressure, if you have blood clotting, if you have a blood clotting disorder or history of deep vein thrombosis or pulmonary embolism, if you have history of breast cancer, have a history of stroke or heart disease, have diabetes-related complications, have liver or gallbladder disease, a history of migraines with aura, unexplained uterine bleeding, or will be immobilized for a prolonged period due to major surgery, or if you take St. John's wort or any anticonvulsant or anti-tuberculosis agents. Your doctor may also discourage the use of the mini pill if you have breast cancer, have certain liver disease, have unexplained uterine bleeding, take anticonvulsant or anti-tuberculosis agents. These are all reasons why they might say that you shouldn't take the mini pill as well. The Mayo Clinic also shares a list of pros for taking the combination birth control pill. So it's great because it can easily be reversed, a reverse method of birth control if you hope to get pregnant. So if you stop taking the birth control pill, you'd probably get pregnant pretty easily afterward. You wouldn't have to wait a long time. We also learned last week that if you got the shot, it might take the shot birth control option. It might take up to a year after your last dose for you to be like fully able to get pregnant again. Another pro is that it gives you relief from premenstrual syndrome or PMS. It offers less severe menstrual cramps or dysmenorrhea. It improves acne. It has shorter and lighter and more predictable periods or fewer or no periods. You can have a reduction in heavy bleeding and related anemia and reduced symptoms of endometriosis. There's also a lowered risk of ovarian, endometrial, or colorectal cancers and possible positive effect on bone mineral density. And finally, there can be improvement in unwanted hair growth caused by polycystic ovary syndrome or PCOS. Now, a few cons of the birth control combination pill is that skipping pills or taking them late may reduce the effectiveness. No protection against sexually transmitted infections is available through them, and that includes HIV. So it really just prevents pregnancy. So if you are looking to prevent STIs transmission, you definitely want to use a condom or some other barrier as well. There's increased risk of high cholesterol, heart attack, and stroke. There's increased risk of blood clots, especially for smokers and women older than 35 years of age, with a slightly greater risk of blood clots linked to pills that contain higher doses of estrogen. There's increased risk of cervical cancer and breast cancer for women who are currently taking combined birth control pills, but this risk appears to gradually decline to normal levels once you stop taking the pills. There's also side effects such as irregular bleeding, bloating, breast tenderness, nausea, depression, weight gain, and headache. So there are also a lot of cons, but overall, these things aren't the worst, and people often choose that they don't want to get pregnant over these risks and live full and healthy lives after taking birth control. Some of the mini pill pros, so this is the pill that only has progesterone in it, is that it can easily be reversed. So again, if you stop taking the mini pill, you can get pregnant pretty easily afterward. It can be taken if you have certain health problems that increase the risk of taking combination pills, combined pills such as blood clots, migraines, high blood pressure, or high risk of heart disease. You're also less likely than the combined pills to have interferences with breastfeeding. And then you also have a lowered risk of endometrial cancer. And then the mini pill cons, it's that it must be taken at the same time every day. If you skip a pill or take a pill more than 3 hours late, you need to use a backup form of birth control for at least 2 days. There's no protection against sexually transmitted infections, including HIV. Side effects such as irregular menstrual bleeding, ovarian cyst, decreased libido, headache, breast tenderness, acne, weight gain, depression, and hirsutism, hopefully I pronounced that correctly, are all cons. And then finally, there's slightly increased risk that if pregnancy does occur, the fertilized egg will implant outside of the uterus, which is an ectopic pregnancy and not a good thing. So that was a lot of information about pills, but just know that there are options, and so many are available. And once you kind of do your research and figure out what works well for your body, there is a right birth control pill option out there for you. And now we're going to get into uterine devices, or intrauterine devices, or IUDs. So intrauterine devices, or IUDs, are free to $1,300 depending on your health insurance coverage, plus the cost of the initial doctor's visit and removal. These are another kind of hormonal birth control, but please note that there's one form of IUD called the copper IUD, and it's non-hormonal. IUDs are T-shaped medical instruments that are inserted into the uterus by a doctor, and they release a small amount of progesterone, which intercepts ovulation and therefore makes pregnancy impossible for 3 to 7 years at a time. During the 3 to 7 years at a time, or while it's in your body. So during the hormonal IUD procedure, it's normal to experience cramping and dizziness and fainting or a slower heart rate. The hormonal IUD can make you stop having periods or make them much lighter or irregular. You might also experience side effects like spotting or cramping after getting a hormonal IUD. This could go away in about 3 to 6 months after getting your IUD inserted. And if you decide that you want to get pregnant, you can take your IUD out and start trying to get pregnant immediately. Again, the copper IUD is a non-hormonal birth control option, and copper IUDs work by deterring sperm. Fun fact, sperm does not like copper. So when they run into the copper IUD, they swim into the opposite direction. And this keeps the sperm from meeting up with the egg, and if the sperm can't get to an egg, then pregnancy can't happen. Copper IUDs must also be inserted by a doctor, as do hormonal IUDs. They have to be inserted by a doctor or medical professional. And the copper ones can last up to 12 years. So side effects of copper IUDs include random spotting during early use, more cramps during your period, and heavier menstrual flows. So if you're a person who actually doesn't get your period and wants to increase getting your period, then the copper IUD might be a great option for you. Some people experience discomfort, including cramps during or after the insertion process, but you can take ibuprofen to help with that, and it's pretty short-lived pain. I've had an IUD before. I would say that getting it inserted and removed was not a fun experience, but it's also a very tolerable experience and has great longer-term benefits than not experiencing that brief bout of pain. There are 5 brands of IUDs approved for use in the FDA. They include the Mirena, the Skyla, the Liletta, and the Kyleena, which release hormones to prevent pregnancy. And finally, the Paragard IUD contains copper, and so it doesn't release any hormones. The Skyla releases progesterone hormone, levonorgestrel. It's called LNG for short, if I remember the pronunciation of that. It should be replaced after 3 years. The Mirena also releases LNG. It should be replaced after 7 years. The Liletta slowly releases low doses of LNG into your body and lasts for 6 years. And then the Kyleena slowly releases low doses of LNG into your body and lasts for 5 years. That was a lot of information. However, if you still are kind of unsure what the right birth control method is for you and whether it's the pill or the IUD or a diaphragm or just some other form of birth control, because there's so many options. There's the patch, there's the implant, there's the shot. You can take the Planned Parenthood birth control quiz, and it'll just kind of ask you different questions so that you can help figure out which birth control is right for you. And a simple Google search of Planned Parenthood birth control quiz will bring that right up. Thank you all for learning more about birth control pill options and the history of them, and then the options for IUDs as well. And if you're looking to support one of the clinics or the organizations that are fighting for people to still have access to abortions and access to choosing what's right for their body and their future and possibly the future of a child, definitely take a look at those clinics that are operating in those states that are going to be experiencing instant banning of abortions, given the Supreme Court's latest opinion. Wishing you all a beautiful rest of your day, but before we go, of course, we have to go through COVID-19 and vaccines. Again, because we're living in the matrix. COVID-19 is on the rise. So if you've already gotten vaccinated, congratulations. You've taken a really important step to preventing yourself and your loved ones in your community from getting sick. Multiple variants are always on the move and developing. So just remember that the COVID-19 vaccine isn't 100% effective. It's not going to prevent you from getting COVID-19, but if you did get COVID, it's going to help you not get really sick with COVID. It'll help keep you out of the hospital with COVID, and it'll help prevent death from COVID. So just stay alert. Feel free to wear your mask if you're in close spaces and don't know people's vaccination status. And even if you do, people who are vaccinated can still get COVID. If you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has COVID-19 vaccine available. And you just need to call us at 202-207-2480 to schedule an appointment. But if you're having trouble scheduling an appointment with us, DC residents can visit vaccinate.dc.gov or call 1-855-363-0333. Maryland residents can visit covidlink.maryland.gov or call 1-855-634-6829. And Virginia residents can visit vaccinate.virginia.gov or call 1-877-829-4682. If you haven't been vaccinated and you're not looking for an appointment, please continue to follow CDC guidelines for wearing masks, quarantining, social distancing, and the like. It's very important that you consider getting the vaccine and discuss COVID precautionary measures with those around you, but also just be mindful of masks and keep your distance. but especially when you don't know if the folks around you have been vaccinated or not. Please remember to follow us on Instagram, Facebook, and Twitter at Whitman-Walker, and check the website at www.whitman-walker.org for the most up-to-date information on our services. And for more COVID-19 resources and general Whitman-Walker information, just give us a call at 202-797-4439. And you can follow our Whitman-Walker family and programs at RealTalkDC_ and NoFilterDC. Thank you so much for your time, and wishing you a wonderful rest of your day.